My name is Esther Marisa Cuellar. I am a registered nurse. I have been for 21 years, and I currently work at Cy-Fair Medical Center in Houston, Texas.
I'm Linda Bertrand. I'm a registered nurse for Park Plaza Hospital, and I've worked there for 8 years.
I got exposure to nursing when I was 12 years old when my brother had an accident, and my mother, who was a nurse, an LVN back in the 70s, got exposed to learning how to do wound care. And I knew that it was a calling and that eventually someday I would become a nurse.
Well, nursing to me came about similar to that. I had a brother who passed away in 1992 from AIDS, and I was very concerned and interested in how that disease process worked. And so I decided that I wanted to become a nurse to find out more about the epidemic.
First of all, I was very, very naive regarding unionization, other than the typical down-up organizing that employees get together to do because of substandard working conditions, poor wages, no benefits, very unsupportive management staff, not having the equipment to do your job, et cetera, et cetera. But that was not the case in my situation. I couldn't go to my immediate supervisor and start, asking all these questions because, come to find out, our management team had a gag order. I could not understand a gag order. So that was another red light. What is going on here? I don't understand. So we had decided that we needed to meet and educate our staff, and originally we were granted a meeting space, but as soon as the union found out we were going to hold these informational meetings, they immediately put a stop to it. They threatened our administrative team.
Which is the same thing
that happened to you.
Where when the union first came, I thought it was so important because of making sure that people were educated and informed about what the union represented, that it was important to have a meeting. So I requested, just like everyone else, the same process, to be able to get a room to hold a nurse-to-nurse meeting to talk about the pros and the cons of the union, not just about the cons, but the pros and the cons of the union. And immediately after that occurred, a week or so later, somehow, it was banned. We could no longer use the rooms. And that was another red flag. I'm like, okay, I've been here 8 years. I'm an employee. I'm not an outsider. Why can't we use the room to educate our staff?
The EPA stands for the Election Procedure Agreement, and this is an agreement between the California Nurses Association and Tenet, our corporation. They came to terms on how the CNA would go about unionizing some of Tenet's facilities.
Yes.
Or attempt to unionize their facilities. So the things that I read in this agreement, it really made me question if this was right, because things were being denied to employees like myself and my team who didn't feel that unionization was in the best interest of our nurses, our profession, our hospital. So I really questioned it, and one of those things was that we would be denied the same privileges that the CNA would have. The CNA, and this is something that I wanted to educate some of our staff on, is they support, some political issues that you may not agree with. For example, they support partial birth abortion. How many nurses are aware of that? How many nurses would, shy away from, oh no, I don't like that idea. I don't want to be a part of that. But once you join, honey, you're a part of that. They may endorse a politician that you are totally against. Sorry, honey, your dues are going to support that politician.
I think their motives really is about the CNA. I mean, this is what they do for a living. So of course they're going to do whatever they can to sell themselves to the nurses. Like Marissa said, we have a Texas Nurses Association. So why do we need the CNA to come here? And we're there for the patients. It's not about us, it's about our patients.
This is not in the best interest of my patients and for my profession, and that's what I'm fighting for. We know best.
Yes.
We do. And these organizers who have no idea what nursing is all about, have no business to be invading our profession.
And they are telling us about nurse to patient ratio, and remind you that none of these people are nurses. The organizers are not nurses, so how can they come and tell me how to do my job best when you don't know anything about what I do?